Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The Schwartz Rounds is a program that allows healthcare givers to gather regularly to share their thoughts and feelings about their work lives. Today, I'm talking about this program with Zeynab Mancini, a chaplain who coordinates the Schwartz Rounds at Upstate. Welcome to the Informed Patient, Chaplain Mancini.
Thank you.
The Schwartz Rounds comes from the Schwartz Center for Compassionate Healthcare, which is a national nonprofit that formed 30 years ago in 1995. Can you tell us about its mission or why it was created?
I would like to start this with a quote from Ken Schwartz, who started the Schwartz Rounds at Schwartz Center. He said, "This act of kindness, the simple human touch from my caregivers, have made the unbearable bearable." The Schwartz Rounds is dedicated to human connection in the heart of healthcare. And today's healthcare environment, crowded with competing priorities, and the human connection is too easily overlooked. And caregivers burned out, patients and families are fearful and suffering. Through innovative programs, education, advocacy, and compassion rounds that we are having through Schwartz Center is working to support caregivers, healthcare leaders, and others to bring compassion to every healthcare experience. The Schwartz Center, as you said, created by Ken Schwartz, and his story is very touching. And he started it after his own experience with healthcare in 1995. And there is lots of hospitals involved with Schwartz Center. In United States, more than 400 hospitals are members of the Schwartz Center, and UK and Ireland has more than 280. And Australia, Canada, and New Zealand also has Schwartz Rounds, are members of the Schwartz Center and doing the Schwartz Rounds at their hospitals.
So it's gone international.
Yes.
So all from this man who was a patient who had his own healthcare crisis and saw how important it was to have healthcare workers who were compassionate.
Yes.
Well, can you tell us how Schwartz Rounds works at Upstate? Who participates?
We started Schwartz Rounds 11 years ago. Every healthcare worker, regardless they are bedside caregiver or not, they are able to participate. They have accessibility to Schwartz Rounds. And we are from administrative to the bedside caregiver, environmental services, supply chain, physical plant, human resources. Even we are having participants from them too. Like everyone who are healthcare worker have access to the Schwartz Rounds at Upstate. And we have planning committee. We have palliative care doctor, we have ED champion doctor, we have wellness chief, we have psychiatrists, we have case manager, nursing directors, we have social workers, we have physical plant, environmental services, and hospitalist and supply chain in my planning committee. We are meeting every few months, planning for Schwartz Rounds and bringing up topics and defining who will be good panelists for the topics. And then we are setting the dates.
What did you do during the COVID pandemic? Did Schwartz Rounds still take place?
Yes, Schwartz Rounds did not stop providing compassionate support and care to the healthcare givers. Especially during the pandemic, there was a lot of need, but we did it online and we again had topics. And also it is not only topics, sometimes it is difficult cases that involves many interdisciplinary teams and that impact them emotionally and their experience and their practice. Sometimes we are bringing up the cases, sometimes we are bringing up just topics relating to healthcare workers' experience.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Chaplain Zeynab Mancini about a program called Schwartz Rounds that gives healthcare workers a safe place to share their feelings about their work lives. What is the goal of Schwartz Rounds when you gather all of these healthcare workers from a variety of roles in the hospital, what are you hoping to achieve when they all come together?
For us at Upstate, our goal is to create the safe space for staff, share their feelings, and safe space for them to be vulnerable, to feel connected, and to gain strength, knowing that there are others who went through similar difficulties and experiences and challenges, and that there are similar stories that empower them and make them connected and make them to feel more motivated what they are doing humanly in their caregiving. We are not seeking for problem solving or fixing what is going wrong. We are mostly focusing on, and we are bringing people to focus on, to process their feelings, to be vulnerable, to just discuss how humanly they can approach to these difficult cases together and empower each other.
Are people allowed to come and just listen?
Yes, as long as they are staff of the state, they are allowed to come and listen. We are also opening it after panelists share their stories. We are opening to audience to kind of to resonate with their feelings, with their stories, with the stories of the panelists too, and that share something from themselves. And it is also a safe space for audience that they can share, process their feelings, and be vulnerable.
Can you give us some examples of the themes or the topics that you've addressed?
I just like few topics from the past year that I have been coordinating. And there is topics that we did when helpers need help, the view of other side of the bed, then taking of the cave from hero to human, or baptized by fire when there is no playbook, and or healing the healer, the balancing and navigating self-care midst of the patient care. And we had also the balancing act, carrying joy and grief in our care, especially coordinated for the holiday season last year.
So the way the titles are, it makes me think, I mean, you're describing jobs that are potentially high stress, but like you said, with joy, but also with some grief. Are you trying to help people learn how to process a stressful job?
We are trying to help them to reduce the stress while they're sharing and they're processing their stressful work, their feelings, and the impact that they are getting from difficult cases, difficult encounters, difficult illnesses.
How do you think programs like the Schwartz Rounds improve healthcare for patients?
Schwartz Rounds improve healthcare for patients by fostering more compassionate, understanding, and emotionally resilient healthcare workers. And then these rounds provide safe space for caregivers to share their experiences and reflect on the emotional impact of their work, and then gain insight of their colleagues. And addressing this emotional strain helps healthcare workers, providers, and professionals feel supported and emotionally balanced. And then they can provide attentive, compassionate, and improving overall patient care. And also, like by encouraging reflection on the emotional and ethical challenges of the patient care through storytelling and shared experience, Schwartz Rounds also helps clinicians and healthcare workers to connect with the human side of the medicine and leading to more empathetic and more patient-centered care. These rounds brings together staff from different disciplines and strengthening understanding among healthcare professionals.
Well, Chaplain Mancini, thank you for making time to tell us about Schwartz Rounds.
Thank you very much for having me.
My guest has been Zeynab Mancini, a chaplain at Upstate who coordinates the Schwartz Rounds. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe with sound engineering by Bill Brocal and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.